There's no doubt that cancer is the world's biggest problem, and it's become personal for both Jackie and I, with us losing family members in the last decade or so. I spent some time going backwards and forwards between Melbourne and the UK when my father was diagnosed with esophageal cancer, and at the time, unfortunately, it was a hopeless case and we lost him. Soon after, I was commissioned to write this book, and it's been far from a easy task, but one that I thought was important to investigate how other families may be able to have better outcomes than we did.
With your journalist training also.
Yep.
And yes, for me, I lost my sister at the age of 56, and I really needed to just sort of find out more about this. It had never touched our family before. And then we thought, well, there's heaps of people who are in the same boat as us. They just don't know what to do.
Yes, I mean, so many families around the world, it does come and touch them personally. One day you're fighting fit and everything is well, and then you get that diagnosis and it changes everything.
Absolutely, yeah.
So we were very lucky in putting this book together to be able to get to access to people who are genuine leaders in their field. I started out looking at the traditional forms of cancer treatment, radiotherapy, chemotherapy and surgery, and looking at the advances that are being made in those fields, and then also talked to people who are genuine trailblazers in the breakthrough treatment types such as immunotherapy and personalised medicine. And we learned not only about the game-changing effect that those treatment types are having for patients, but also how nowadays a multi-pronged approach is getting great results, with teams, specialists in different fields coming together and their collaboration being of more benefit to individual patients.
And cancer is all about people and how it affects people. In each chapter, we begin with a long story about how someone's dealt with it, how it's affected them, and the treatment that they've had. But also psychosocial oncology is one of the fastest growing new parts of cancer treatment, and that's dealing with the whole person, how it affects their life, their family, their work, etc. So we have a whole chapter on that. And then we were thinking about survivors, because there are more survivors than ever before. And
as a result of the breakthroughs.
Exactly, yeah. And so how do you make the most of your life so that you stay as well as possible? How do you eat well? How do you get enough sleep? And the importance of exercise. And then we've added a whole lot of recipes so that you make sure you get the maximum nutrition out of every single bite.
Yep. Yeah, so there's a fair bit of science in the book, but most importantly, we wanted to really bring that people element into it and some really practical help and advice to make people feel more fortified as they go on their cancer journey. And that definitely, well, Jackie's research shows that in those later chapters in the book that's an important facet in having a better outcome.
So the book is not just for cancer patients, it's for friends and family. Like, for example, when I had a friend who had cancer, I didn't know what to do. I didn't know how I could help. And a lot of people just have to close off from that person because they just feel really helpless and they don't know what they can do. So it's for family and friends, and it's for survivors as well.